where the theme is baby boxes. Just a couple of quick things. I'll introduce myself and then hand over to Jen and the team from the Children's Network. For a quick update, we're recording this session. If you've been to huddles before, that's for sharing purposes. And we've asked everybody to introduce themselves in the chat, if you can do that. The format for today will be, we'll hear from the two main presentations and speakers. And we'll, after a short break, have a Q&A with you all. Again, please put your questions as they arise in the chat, and what we'll do during the quick comfort break is try and collate them into some sensible order of questions that will be discussed and asked on your behalf. So use the chat very freely. I'll introduce myself properly in a second when it comes back to me, but I'm going to start the meeting properly by handing over to Jen and the team to talk about the work of the network.
Thanks so much, Guy. Morning, everybody. My name is Jenny. I'm one of the network delivery managers for the Child Health and Wellbeing Network. I'm really grateful to you all for giving us your time today. If you're not familiar with the network, I'm just going to give you a brief overview of where we are, who we are, what we do, so that you can hopefully engage with us going forward if you're not already a member. Our network is entirely dependent on its members, so if you don't already engage with us, today is an excellent first step, so thank you for being here. So as a network across the North East and North Cumbria patch, this is our vision. We're all about working together and collaborative working, keeping children, young people and families at the forefront of our minds always. And then basically what we do is to sort of make people work together, share good practice, drive excellent work that's happening, create new pieces of work where we can, and just basically connect people together, build relationships and make things happen, hopefully, is the plan. So we do sit within the NHS, currently within NHS England. We cover the whole ICB patch for the North East and North Cumbria. You can see the map there, all the way from the tip of Northumberland over to West Cumbria, over to top of North Yorkshire. So it's a huge patch and it's the biggest ICB in the country. So we do have a big population, a very diverse population, and a lot of problems, which you are probably more than aware of, not the least of which being the levels of child poverty that we see in this region, which obviously has quite an impact on the focus of our work. So you can see there that the by region Northeast comes out on top, or at the bottom if you prefer, in terms of child poverty. So it's a huge issue for us. It's a huge issue for all of the system that we work within, and has a big bearing on a lot of our priorities. If you're used to working with babies and early years, as I'm sure a lot of you will be, it's important to understand the lifelong health impact of those early years. And if children and young babies are not getting the optimal conditions for their growth at that time, it can have lifelong impacts. And this is something that we're sort of trying to raise awareness of within the system. It's, if you want to think about having healthier adults, you need to start with having healthy children. So the focus of that, this is a really interesting report actually, if you haven't seen this before, from the Institute of Health Equity, it came out last year. But it's really driving our focus on the effects of things like living in cold, damp homes, for example, on children's health and well-being. So if you get the chance to have a look at that, if you haven't already, I'd recommend that.
My children went camping on Monday with the school, just camping at.
Could I just ask people to keep the microphones on mute? Sorry if people are just joining. So the Facts of Life report was a piece of work that we did back in 2021, but it still stands really in terms of the stats that are in it. And it's a great base for looking at the evidence around different metrics for child health and wellbeing by geography. And you can see there just from this snapshot that we've got here in terms of child poverty, the amount of red that we've got as being below the England average is quite stark. So if you're looking for any data on these sort of topics, having a look at the Facts of Life report is quite a good place to start. And yes, it's a couple of years old now, but if anything, after the pandemic, they're probably even worse now than they were before in a lot of areas. So yeah, it's a bit of a stark reminder of the conditions that we're working in. So as a network, these are the priorities that were given to us, we always say, by the system that we work with. So we did a number of engagement events with professionals and young people back in 2018, 2019. And we came up with this priorities wheel just as a way of demonstrating what was important to the system. Children and young families at the centre, children, young people and families, I should say, at the centre. And then you can see those different priorities around the outside, poverty being one of them, inequalities, and then sort of more specific areas of work as well. And then they're underpinned by our enablers and our cross-cutting themes as well. So that whenever we sort of reconsult with people around the priorities, the CYP voice, mental health and poverty always come out at the top. And then everything sort of fits together anyway as a cross-cutting model anyway. We rarely look at things in isolation because so much of it impacts the other. Just in terms of the population that we cover, I've mentioned about the geography, but just in terms of the percentage of the population that count as young people, we cover young people up to the age of 25. So we're starting with our baby boxers and we're working all the way up to young adults. 0 to 17 percentage there is about 20% of the population. Up to 25, it's about 25% of the population. So it's a good chunk of people in our region that we sort of advocate for within the network. Network membership, as I say, if you aren't already a member, we'll give you links in the chat that you can join today to make sure that you can keep abreast of everything that we're up to. We've got over 1,800 members now, and that's across the system really. You can see by a breakdown that we've done there. It's a largely health, but we have a huge number in education. VCSE are really important partners for us, local authority and public health, and then other is anything else that you can imagine really. As you can see, things like emergency services and sports coaches. Arts and culture is a huge area of our work that is one of our cross-cutting themes. So it's that link between creative arts and health is something that we're really trying to build on. And then we do have a core team, of which I am one, clinical advisors and other advisors. We have health inequalities advisors who work with me on some of my project work, for example. And then we have currently a young apprentice based within Middlesbrough Council who's a care leaver, who helps us to understand more about that area of work. And then we always sort of keep coming back to this in terms of a quote which really resonated with us when we first came across it. Sir Al Ainsley-Green, who was the first Children's Commissioner for England, was really supportive of us when we were trying to set up the network back in the day. And he was really sort of felt quite strongly that we had an advocacy role to play for raising the voice of children and young people. And they're quite often forgotten in the sort of wider machinations of the system. And we have to be their voice and stand up for them, the most vulnerable in our society. And if we don't, then who will? Because they're quite often forgotten about within the system that very much focuses on adult care and adult services. So that's why we're here, and that's why we do what we do. And we're very grateful for you to be here too. And with that, I'm going to hand back to Guy, who's going to chair our session today, as he says, to introduce himself properly and just give a bit more of an overview of what we're going to hear about today. Thanks, Guy.
Thank you ever so much, Jen. So my name's Guy Pilkington. I'm a GP by profession, and I've had a number of jobs in my time over the years, 34 years, 35 years as a GP. Some of it has been in commissioning, some of it has been in other roles, and currently I chair the prevention board for the North East and North Cumbria ICB. The reason I'm chairing this huddle, though, is I sit on the executive of the Child Health and Wellbeing Network, and I'm one of the VCSE representatives within that, because one of my newer roles is that I chair a charity called Ways to Wellness, which we created within Newcastle originally to support social interventions, particularly delivered by VCSE alongside the NHS to support better health and well-being. If you do think that inequalities and preventative approaches matter, then clearly the people we're talking about today really matter. As Marmot and many others have pointed out, if we want to tackle inequalities in people's chances for healthy and successful lives, we have to start early, and children and young people are clearly the most important population in all of that. I'm really also absolutely convinced that change for a problem like unequal outcomes are rooted in societal factors first and foremost, whether that's poverty itself or all the other things that we wish our society was somewhat different, perhaps. And I don't think the solutions are easy. There will be very much rooted in relationships. If this is a wicked problem, the solution is all about the relationships that we build. And therefore, a network like the Child and Health and Wellbeing Network is absolutely the kind of approach that will produce great things, and it does on a regular basis. So if you're not already a member, please do join up. As Jen says, there's much to be achieved by those informal networks and just getting to know each other. Today's topic is all about baby boxes. I'm sure many of you will have read about them and their use in Finland, as far as I remember. If I'm right, that's where the idea originated, where I think it's still a universal offer. We haven't got anything like that here in England. Scotland has explored baby boxes perhaps in greater ways than we have in England, but we are really fortunate today to have a couple of very important local projects and pilots to hear from, and I'm really looking forward to this morning. We rely very much on the chat. So a reminder that if you have got questions, we'd like to hear them. Please put them in the chat and we'll do our best to capture the things that you want to talk about in the Q&A from the things that you put in the chat. And finally, hopefully everybody's been able to describe a little bit about themselves in the chat. Have a flick through who's in the room. We're up to 45 people now, according to my screen. A lot of people, a hugely rich audience with all sorts of fantastic skills for this topic this morning. So a very warm welcome. I think we on the agenda are going to hear first from Claire Allen from the Children's Foundation, and then we're going to hear from Caroline and Amy, who are going to talk about the other project for today, which is delivered by Down Syndrome Northeast. But first, it's over to you, Claire, and the Children's Foundation pilot, principally based in Gateshead.
Wonderful. Thank you, Guy, and thank you very much for everyone being here. It's really nice to meet everyone, and it's lovely to see such a lovely turnout. So yes, I'm Claire, and I'm the project lead for the Children's Foundation. The Children's Foundation is a small, independent little charity in the heart of Newcastle, working with the most vulnerable children. The baby box is there it is in its honour. So the baby box, the aim of the baby box is to give every child in the Northeast the best start in life. And the project was created back in 2020 when we reached out to children, parents, midwives, health visitors, GPs, the 1001 Critical Days movement, and the Regional Voices Network. And we learned so much about how vital those early years are in shaping the rest of our lives. And what we were talking about at the start, the healthy relationships, employment opportunities, mental health, it's everything. So this was our solution. It's the baby box, and the whole focus of the baby box is around baby development. So everything inside it is books and toys, and they are themed around laughing, playing, singing, counting and reading. So it's really hard to demonstrate how wonderful the baby box is without actually having it physically. So we've got a lovely video, if we go to the next slide, which demonstrates it quite well.
This is the Children's Foundation's new baby box. Our baby box is unique with a primary focus on baby development. Our boxes are packed with developmentally stimulating books and toys with a focus on laughing, playing, reading, singing and counting. The box also contains essentials like a blanket, changing mat, bath towel, first toothbrush and thermometer to get families started with baby care. The Baby Box project has been shaped by parents, midwives, family nurses, health visitors and GPs, and is currently being piloted with Gateshead NHS and Barnardo's.
The box would make you feel so much more prepared as a new-time mum. You wouldn't have to worry about going out and buying all these things. It's been gifted to you.
I think it's a wonderful opportunity because it's delivered so early to them, sort of in those very early weeks of pregnancy, and a wonderful box of resources which identify so many different facets of being a parent. So it's about the child learning new skills and about being curious, but it's also an opportunity for parents and child to come together to play and interact. So it is building that relationship between mother and baby.
I feel like it would help connect with your baby, especially if you've had the baby blues. You don't feel like you have that connection, but there's loads of things and items in the box that would help you connect to your baby.
I wasn't really looking more at the sensory toys, and they're included in the baby box. It just like, it was a weight lifted off my shoulder.
The baby box would make a massive difference to help my baby's development as well. My favourite item out of the box got to be that book with the mirror in. I absolutely love it, and he loves it as well. Just looking in a mirror. I think babies love like the light and the reflection, and I think it's his favourite thing out of the box as well.
Especially some of like the cards had like information on about like playing with your baby and communicating with your baby.
Positive experiences early in life are associated with better social and emotional development, education and lifelong health. We want to remind new parents and families that they are cared for, and to promote a great start for all children born here in the North East. The Baby Box, supporting babies in the North East to have the best start in life.
Wonderful, thanks Jen. We can go to the next slide. Wonderful. So that was the baby box, and it's a really good way of demonstrating it. And little Tommy, the little baby, was fantastic on the day. So the baby box actual project got underway in November 2022, and it started with a pilot of 50 boxes at Gateshead NHS through the free maternity pathways of the Family Nurse Partnership, the Enhanced Parent Pathway and Continuity of Care. We have recently been awarded additional funding through the family hubs to reach another 400 families, which is amazing. It is also now being piloted at Newcastle NHS on the Healthy Child Plus pathway, and that's in the East End of Newcastle. And it's being also piloted at Barnardo's in Byker Sands. At the moment, it goes to first-time families who are vulnerable. So they might be vulnerable because of mental health, or it might be a history of leaving care. There could be lots of factors for why they're classed as vulnerable. So that's where the box is being piloted at the moment. I'll just go to the next slide. So how does someone refer in? So currently through Newcastle, Gateshead and Barnardo's, the midwife or the health visitor would be the one who would refer. So at about 25 weeks, they would complete the online referral form with the parent. The parent would know exactly what they'd be getting in the box. That referral comes through to us at the Children's Foundation, and then we get in contact with Stiller Warehousing, which are a lovely family business who are volunteering to store and pack and deliver every single box. So they get professionally delivered by DPD to the family's home 4 weeks before they have the baby. So it's really smooth, wonderful service in that sense. Logistics are half the battle. There's no boxes piled up in NHS taking up spaces. It goes straight to the parent's home, and they get that amazing gift of all the bits. So in the box you will have seen you've got the Little Orange Book. The National Literary Trust are now working with us as our book trust. We've got the Icon Coping with Crying leaflets. You've got a thermometer. There's the essentials like a blanket. And in terms of the books and toys, you've got nursery rhyme books, black and white books. You've got a musical instrument, sensory toys. It's a whole lovely package for parents to receive. So let's go to the next slide, please. So the process, I've talked about the process, but the feedback we've got. So as part of the pilot, which we're running at Gateshead, Newcastle and Barnardo's, we have been completing an evaluation because we wanted to understand the impact on baby development, how it's helping parents interact with their baby and bonding, and how the contents of the baby box is being used. That evaluation is being completed with the Clinical Research Network in the North East and the Children's Foundation. So we do 3 questionnaires over the telephone, and we speak firsthand with parents and find out about the baby box and how it's being used. I've been chatting to parents myself, and the feedback has been amazing. It's made people feel really supported, confident. They've used things like the play mat, which it's wonderful. They can put it down in a clean space. So it's been really lovely to hear. If we could go to the next slide, please. So these are some of the testimonials we've had from the parents. Like I said, I've been chatting to the parents myself, and a huge lot of the words are just an absolute relief to get this baby box at a time when the cost of living is so high. Their favourite items in there, they say they like everything, which is not helpful when you're trying to work out what to take out. But one of the things that they absolutely love is the play mat. They love the Little Orange Book, which is an absolute godsend. The Icon leaflet, which I didn't actually think, I thought they probably won't read it. The parents are reading the leaflet and they are learning. I've had parents saying, do you know what, that leaflet's really helped me understand what to do and how to cope when my baby's crying. We've got dads who are reading nursery rhyme books, parents who didn't know any nursery rhymes because they hadn't heard them before, and they're now reading them to their baby. So it's been really lovely to hear that the box is having the impact we hoped it would. The other point of the whole box is that it's not just a box of stuff. It's working with the midwives, with the health visitors. We couldn't do this project without their input and their skills. So if you go to the next slide, please, Jennifer. Claire Ronan, she's a family nurse, she's on the call as well. She's at Gateshead, and she's fed back how it's just such a useful tool as a health visitor or a family nurse, because you can go out into the home with that parent and you can demonstrate how to use those items with the baby, whether it's doing tummy time, whether it's doing peekaboo, whether it's using the NSPCC cards to give parents ideas and on how it's the doing. So it's the bonding through doing. And it's that whole picture of working together with health visitors, with family nurses, with GPs. We also cheekily sent the box to the Children's Commissioner for England, and she absolutely loved the box. She created a lovely video for us, which we were able to show at our launch event, and she thinks the box should be made available nationwide, and we would love that to happen. We want it to sit with NHS trusts, but we're interested in working with both statutory and voluntary organisations. We're getting so much interest now from prisons even as well, local councils, and our goal is that first and foremost we want it to be available across NHS trusts in the North East. So yeah, if we could go to the next slide, that'd be great. Yep, so this was the testimonial from Claire at Gateshead, and again, just picking up on what she said, it's about those interactions that are being created through the art of doing, the parents seeing the child not just as their physical needs and their emotion, and seeing them as a physical being, but actually their emotional needs and what they need and how to interact. The box is like almost a toolkit, if you like, of being able to do that through nursery rhymes, through playing peekaboo, through the sensory toys, through stacking, through using, you know, giving parents ideas of how to use the items to play with their baby. And it's getting it right at the start, isn't it, which is having the impact longer term, and that's what we hope this box will do. If we could go to the next slide, please. So this was some media coverage that we were lucky to get on BBC Look North, and I think this is a great way of showing, this is one of the parents that received the baby box in Gateshead. So if we could play that, that would be wonderful.
The charity hopes to help tackle childhood deprivation by delivering boxes full of toys and books to hundreds of first-time parents in the North East. The Baby Box project was created by the Children's Foundation and aims to give families the essentials needed, as well as stimulating baby development. They're being made available to vulnerable families in Newcastle and Gateshead to help those struggling with the cost of living. Steph Cleesby reports.
At 2 months old, baby Isaac is starting to engage with everything around him. And thanks to the baby box, he has lots of new books and toys to play with. Delivered to the parents' home about 4 weeks before the birth, the baby box is packed with lots of essentials, including a blanket, changing mat and thermometer, giving a helping hand to first-time parents like Simone Gomes.
There's a blanket, there's a sleeping sack as well that I've been using since he was born. There's a changing mat. I literally take it everywhere I go. As a, you know, like a low income, it would be probably really, not really hard, but kind of hard for me to get a few the toys that I've received on the box. As a play mat as well, some of them are like kind of expensive. So I'm really grateful to receive this from the baby box.
This looks really good because it's like black and white. The whole idea is that it's focused on baby development, and that's what's unique about it, and it's about understanding how important those early years are in shaping who we are.
The midwife-led project was set up by the Children's Foundation with the aim of giving first-time parents and their newborns in the North East extra support. Following a pilot project in Gateshead, the boxes will soon be available to vulnerable families in Newcastle too.
When I'm speaking to parents, they're telling me that this box has saved so much money. It's allowed me to have things that I definitely wouldn't have been able to buy for my baby. We know that the cost of heating of things, and that is a real worry that people aren't heating their houses. Things like bathroom thermometer is really handy because it's making sure that that temperature is the right one for babies, you know, when they're asleep at night.
I think all moms should receive this box. I think he helps, you know, like the first time moms that don't really know how to do, and like, you know, like they're not like 100% prepared, you know. I think it's really great.
The goal is for the project to roll out to every NHS trust in the North East and eventually nationwide, making those early days of parenthood easier and helping to give babies the best start in life. Steph Cleesby, BBC Look North, Gateshead.
Thanks, Jen. Sorry, it was quite hard to hear, wasn't it? It was quite quiet. So in a summary, she loved the box, yes, she loved, particularly, it was just a huge relief for her, and she absolutely loved the little orange book that I was saying about in the play mat. Yeah, if you get a chance, I can send that video around, perhaps in an email, so you can see it, but it was lovely. So next steps, the box can be delivered locally and nationally. Because we have Stilla, who are wonderful and helping us with the logistics side, it means that we can actually deliver anywhere. So we are interested when working with a wide range of organisations, both statutory and voluntary. The process is really easy to refer if you're a midwife or health visitor or a support worker, whoever it is that's referring in. Currently, it's being piloted at Gateshead, Newcastle and Barnardo's. We are currently setting up a national steering group. So if you'd like to get involved, then please do get in contact with myself or Sean. You can also email TCF Baby Box, and we will obviously share details afterwards. So yes, I think that's all me finished. So yeah, open to any questions or anything else.
Well, we've got, after the break, we're going to have you're going to be on our panel for a lot of questions. A couple of immediate ones. You hinted there about expanding and moving into different areas. There was a question about when will other localities within Newcastle be incorporated within this, was one of the questions.
I think it simply the simple answer is it comes down to funding. So when we started this project at Gateshead, it started with lots of different pots of money. So it was like the postcode lottery, it was Gateshead, it was Catherine Cookson Foundation. Newcastle, for example, we've been able to do that through Newcastle Hospitals charity. The additional funding at Gateshead's come from the Family Hub funding, so it really depends on the funding available to fund the project. So we would definitely like to expand across the other localities in Newcastle, the North East, and that's definitely the plan. So yes, if we can get the funding, then we will definitely be expanding it.
Great, thank you. Sean is on the call, I believe. Sean is the CEO of the Children's Foundation. Do you want to come in and add anything to what we've heard from Claire there?
I'm just going through mic, camera, action. Right, I hope everyone can see and hear. Thanks. Yeah. For me, this project has been sort of in the making since 2020, as Claire said, and is our sort of, as the charity turned 30, it was a link back to the yellow brick road of the 90s, but very much a focus on the needs of now. And we held extensive online at the time, because it was COVID, focus groups with new parents and parents to be, and the Regional Maternity Voices Network, to kind of ask parents what they felt was missing or what was needed, because nobody prepares you to be a parent. And I think whether you've got the best family support and the wealth to get you started, or you have nothing, we all start from that same point, and nobody prepares you for that. If you have that peer support, if you have that family support, if you can draw on your own experiences, great. But if you don't have that, or you come from a chaotic background or difficult circumstances, it's a barrier before you've even begun. So for us at the Children's Foundation, this was about two things. It was about parental confidence, and particularly maternal mental well-being, but also baby development, and that's what makes this box unique. This is not like the box in Finland. This is not like the Scottish baby box. It is not full of nappies and bibs and baby grows and muslin cloths. This is about baby development, but through simple everyday things. For me, if this is to work and to work at scale, we need it to be something that anybody can do. And when I say that, I relate it to myself. Any old fool needs to be able to do these things, just almost without knowing it, which is why we based it on those principles of play and read and sing, talk, count, etc. It is a pilot in Gateshead at the moment. Gateshead have been phenomenal. The charity raised some funds through grants and trusts, and there was some sort of non-recurring funding that would be able to add to that to enable those 50-box pilot in Gateshead. They then wrote that into their bid to Department for Health and Education for the Best Start in Life funding through government, which has enabled the additional 400 boxes over the next 2 years. We want to embed this within the NHS from the off, because that's where we feel it should sit longer term. A little bit like well, they're now red, but the little yellow book of child health, which on the back of the Yellow Brick Road appeal, the Children's Foundation funded here in the North East. Some people on the call may have some of those yellow books still. We want the same thing to happen with this baby box, but we're going to have to work with commissioners and NHS providers and local authorities to enable us to do that. We don't have the £12 million that the Yellow Brick Road appeal made in the 90s. There is a fundraising appeal that sits alongside this, which is called the Make a Million, or MAM for short. But that only allows the charity to respond to kind of like ad hoc responses. We're trying to keep it coordinated, keep it focused. Yes, start with those most vulnerable families, but we do intend that this box is universal for every first-time parent in the North East. And as Claire says, we're leading that national steering group as well to share the learning from the North East and what the parents have said You know, we wanted to get the voice of the parents across in this call because they're the most important. So to hear from those mothers in those videos was vital. And one of the unexpected outcomes of the box to date has been the cost of living. And actually, that wasn't something we'd factored in when we began to pull this project together. But actually knowing what resources you're going to get in that box when the midwife or the health visitor introduces that, get the 12-week or the 20-week scan, makes what very little you've got go a heck of a lot further if you know you're going to get those items before your baby's born. So it's been a sort of like an unexpected outcome, but it just kind of like adds weight to the argument of why this is so important for us. So I hope after today's call, people can help us, you know, get this box out to as many first-time parents as possible. I'll shut up.
Thank you so much, both of you. Claire, that was absolutely fantastic. I've got 101 questions, but I'm going to save them till after the break. And I think we will be moving on here. But just to say, I love that approach, that this is about bonding and development, and that kind of important function that could otherwise, you know, not have quite such a successful start for the families concerned, I think is just wonderful. So I've really enjoyed that. I hope you too have on the call, and we will have lots of time to talk to Claire. And if you've got time, Sean, please join us on that panel after the break. So we're moving over to Caroline and Amy, who are going to tell us all about the Down Syndrome Northeast baby box. And if I hand over to you to introduce yourselves and take us through your presentation, that would be great. Questions in the chat, please, everybody. Lots and lots of questions. We're doing our best to capture them all.
Thank you. Hi, I'm Caroline Turner. I hope you can hear me. I am from Northeast Charity, Down Syndrome Northeast. And I'll tell you a little bit about the charity first of all. The charity has been running for about 20 years. It's entirely parent carer led. We're all volunteers, so we don't have any employees in the charity, and we're all parent carers who run the charity from our homes effectively. We are an organisation which provides support for families from babies, from new babies right through to adults of all ages, and we run a range of activities and provide support for parents, for families, and for people with Down syndrome throughout their lives. The reason that I'm part of the charity and the reason that I'm part of this project is because I have a 7-year-old son called Leo. He has syndrome. He was born in 2016, and when he was born, we didn't receive any support or information about Down syndrome. We received no signposting. We had an antenatal diagnosis, and off we went from the hospital with effectively nothing. And the same thing happened when Leo was born. When he was born, I had no information, and everything that I acquired in terms of information about Down syndrome and what life was like to have a child with Down syndrome, I acquired from either online, social media, and other parents. So part of this project is to make sure that other parents don't experience what quite a lot of families like myself have been through in the past. And obviously this is not something new. This has been something that's been ongoing for a very long time. We decided that we wanted to support families who have a new baby who has Down syndrome or have an antenatal diagnosis. And we wanted to put something in place that would make sure that families had access to the support services that are not only available locally but also nationally, because we know that there are a lot of really great national charities and organisations out there. And also a lot of great local support, but families and professionals, in fact, who are working with those families quite often don't know that they exist. And so a big part of the project was to make sure that that was provided for our families. So we talked to parents about what they would actually want, what they would want in a baby box, what kind of things they would want when their baby was born. And largely a lot of parents referred back to the fact that when they had their diagnosis, be it antenatal or postnatal diagnosis, they felt like they were the only ones. They felt like they were very much alone, and it's really quite a daunting and frightening experience for a lot of families when they do feel like they're alone in the situation of having a baby with Down syndrome. And so part of the project is about celebrating the lives of and the birth of our babies who have Down syndrome, and also making sure that families do have signposting and do know that they are most definitely not alone, and there are a lot of other families not only nearby to them, possibly in the next street, that they just don't know are there. So families told us that they wanted that signposting. They wanted to make sure that that they could find out about what it was like to have a baby with Down syndrome. We knew that there were a couple of other organisations across the UK who were already delivering baby boxes, similar to ourselves, parent carers who are entirely volunteers who are setting up the baby boxes themselves. And so we reached out to them, one in the south of England and one in the northwest, and we talked to them about the things that they were putting in their boxes. And we wanted to kind of take their model, but also make it particularly bespoke for what the Northeast experience and the families in the Northeast are wanting. So the families told us that, as well as finding out information about other families and actually finding out what life was really like for a baby and family when baby had Down syndrome, they also wanted to know that they were going to receive something nice in the boxes, you know, some nice little gifts and toys and treasures and things that they could, you know, keep and use and have long term as special mementos of baby being born. Because, as I said before, we really strongly believe that it's really important to celebrate the birth and the lives of our babies who have Down syndrome. And sadly, that we know that that's something that doesn't necessarily happen within society, and a lot of our families don't get that feeling and that experience from when they receive their baby's diagnosis. So we wanted to, you know, put that right and make these gift boxes a celebration of the birth of their babies. We worked quite closely with a lot of organisations within the voluntary sector. So we have been, because we're volunteers ourselves, we're very much reliant on the fact that there are other organisations out there who want to work with us. So we work with a group called Project Linus, which is across the Northeast, a group of ladies who crafters who make quilts. And so our boxes include quilts which families use as play mats. Thank you. Sorry, I should have said to move the slides on. The quilts have been made for us right from the beginning and are really lovely, and everybody gets a kind of a bespoke quilt in their box. As well as that, we work with organisations who donate things like toys and gifts and so on, which also go in the boxes. I'll talk a little bit more about the content when I've told you a little bit about the pilot project. So the initial boxes were put together in 2021, and they were really focused on North Tees, which is my local hospital. I live in Stockton-on-Tees, and we began by having some boxes, some gift boxes available for new parents, which were taken on by the screening team and the maternity and special care team at North Tees Hospital. So they've been there for about 2 years now, and that was really successful. And we know that families were given those gift boxes and really appreciated them. But at the same time, we also, because you know, it's quite a hard task when you're a volunteer to make those connections with hospital staff and with trust staff across the whole of the region. We're very much aware of the fact that it's quite a slow process to get those out there and to make those links. So the North Tees pilot began, was really successful, really effective, and since then we have worked really closely with North Tees, South Tees, so James Cook Hospital, Sunderland Royal, who've been very supportive and have had our baby boxes in for quite some time too, and also Darlington Memorial Hospital as well. So I would say probably about 50 boxes, or around 50 boxes have gone out between the 4 hospitals over the last 2 years, to make sure that they're available. And we know that it's tricky for the hospital staff to find storage, so we kind of give them maybe 3 or 4 at a time, and then when they need some more, we provide extras. In addition to that, families who maybe didn't receive a box in hospital, or baby was born in one of the other hospitals in the region, if they contact us, or a healthcare professional who's involved with them contacts us, we send out one of our gift boxes through the post, or one of our volunteers delivers them to the family's home. To make sure that all families are able to get them. And quite often we do find that families, don't contact us straight away, haven't heard of Down Syndrome North East, and maybe if the professionals working with them don't know that the boxes are available. So we do end up giving the gift boxes out up until babies are around about a year old, because it can take some families a little bit longer to get in touch and to be signposted. Unfortunately, we would love them to be in all the hospitals, because that would make it a lot easier for all the families, and for the signposting staff, and also for ourselves too. As I said, the North Tees pilot was really funded entirely by ourselves, and by support from other voluntary sector organisations who were working with us. And a lot of it was done through fundraising by our families, effectively, and family support to make some of the contents of the boxes available to us. Really pleased to say, though, that the ICB have provided some funding for us to ensure that for the Tees Valley hospitals, so for Darlington Memorial, James Cook, and North Tees, we secured some funding to make sure that is going to be available for at least 3 years, if not more now. So that guarantees the boxes availability. And we're also working on funding through the voluntary sector organisations to make sure that is also the case for our families in other parts of the region. So I'll tell you a little bit about the contents of the boxes then. As you can see, the books there are quite a crucial part of it. The book called Nobody Told Me and Wouldn't Change a Thing, which you can see come from 2 other national charities. The Wouldn't Change a Thing and Nobody Told Me are both very similar in that they are the life stories of families who have Down syndrome, who have a baby with Down syndrome, a child with Down syndrome, and they enable parents to find out, what life is going to be like for them having a child with Down syndrome. There are children's stories from all ages, and we also have some lovely stories from adults who have Down syndrome talking about their lives and showing their life experience, and the celebration of their lives in both of those books. And so they come from national organisations that we get them from. The book they're called Look at Me is our Down Syndrome North East book, which we're really proud of, which we just created last year. And it's about people in the North East who have Down syndrome, and it's a celebration of their lives. And quite a lot of it is including the photographs from a photo exhibition that we took. The models were taken, the photographs 4 years apart, and the wording is from the people who have Down syndrome themselves, or their parents and carers. And so those lovely books are in there, and you can see from the other picture. You can just move on to the next slide, please. I'll show you a little bit more about the contents of the books. So you can see there that there's quite a lot of signposting to organisations in the North East, such as LD North East. Together 21 is a group for children with Down syndrome. It's the only one in the North East of England. We signpost to national charities such as the Down Syndrome Association, Positive About Down Syndrome. And we also make sure that parents are aware of services such as the Alan Shearer Centre, the Tim Lamb Centre, and other organisations that provide support for families and provide activities for families too. We've got some lovely sensory toys in there. Quite a few of them are knitted by our lovely crafters, and we've also got some items that come from our charity too. We've got some little vests that the vests are made by one of our volunteers, and they're there to celebrate our children who have Down syndrome. And so they say things like, I'm downright perfect, and love doesn't count chromosomes, and so on. Lovely little messages to encourage, and support parents, and to show them that there is a really positive journey ahead for them with their new babies. Could you pop onto the next slide for me, please? So you can see some of these are the little handovers that I've done when I've been around and about the northeast to the lovely neonatal and maternity staff in Sunderland, Darlington and North Tees. And they've been hugely supportive in those 4 hospitals to make sure that the boxes go out to the families and to make sure that the families access the contents and the services and so that they know that they've got that support in place. Pop on to the next one for me, please. As Claire was saying about parent feedback, equally, it's really valuable to us to get parent feedback. And you can see some of the examples there about how emotional parents felt when they received this, because if you're a parent of a baby who has Down syndrome and you are in a scenario where you believe or you get the impression that life is a disaster because you've had a baby who has Down syndrome, and obviously we want to turn that around and make sure that parents are welcomed into the Down syndrome Northeast community and into the community nationally and locally. And you can see how some parents they're really grateful for the incredible support. They've been overwhelmed by being welcomed and supported right from the outset. One of the mums I sent a box to there, she said she had a little cry when she received the box because it meant such a lot to her in some difficult times that she'd had in those fairly tough early weeks that she'd experienced. And we know that quite a lot of our parents do experience some mental health difficulties and some challenges as they're coming to terms with the needs of their new baby and that diagnosis, which can be, quite tough. And so we want to make sure that families have as much signposting, as much support to national and local organisations as possible. Can you pop the next slide on for me, please? And I'd just like to finish by showing you some of our little people, our beautiful babies who have been recipients of our gift boxes. The little girl Amelia on the left of the screen there, she is about 3 weeks old, and that picture was taken last week, and she is a parent, family local to me, and she is enjoying her little gift box goodies and enjoying life. And you can see the others have got some of the gift box items with them as well. And obviously some of our babies can be born early and maybe can be a little bit poorly when they're born. And so we make sure that we have those links with neonatal in the hospitals that we're working with already as well. So I know that there are quite a few people on here from hospitals that we don't work with. I am going to put my email address on. Anybody who is from the trust in Newcastle, Gateshead, and Northumberland, I have been reaching out to your hospitals, to other staff. I'm desperate to get them to your hospitals to make sure that our families across the Northeast get them, because I know that quite a lot of families in those areas haven't been accessing services and haven't been receiving the boxes. So I am going to leave my email address. Please do get in touch. And I'm just going to hand over to Amy now, who's going to tell you a little bit more about a wider part of this project.
Thank you, Caroline. Such a good project that, and such lovely photos there at the end. What cuties. I feel like mine's a little bit of an add-on here, but I think it's nice to be able to show you how we can translate those boxes into pathways and commissioning, and how we've managed to do that with North Tees. Caroline's been absolutely pivotal to this work as well, which has really, it started from those gift boxes, I would say. So just to give you a bit of background, we did some consultation with parents, and I will say that at that time it was the Network's own Louise Dauncey. She works with them now, but at that time it was her that led these conversations with parents in Stockton and Hartlepool, who, as everything what Caroline said, I won't go over it because I know now that we're getting a little bit short of time, but families were left feeling without support and signposting and good information, and obviously the amount of services that might be involved in your child's life when they have Down syndrome, knowing what services do what, and it's all a little bit confusing. So we tried to work with the boxes and what was already started there, and we've tried to expand on that really with the pathway work now. Could you just move on to the next slide, please? So what we did in with North Tees and Hartlepool, the Stockton Parent Care Forums and Hartlepool Parent Care Forum with their parents, mapped out their journey of exactly what was happening for them and what it meant to them, and let us know what the key areas for improvement were. So we set up a steering group, which Caroline from DSNE was a key member of. We got parent carers on there. We had the trust staff and therapies leads. We got 0 to 19 involved. And this group met for about 15 months. And what we got the parents to do was they did a presentation back to the trust staff to explain to them what their experience was. And to be quite honest, that kick-started our project really well, and the engagement was fantastic from the trust right from the very beginning. So that steering group continued to work for about 15 months, and we built a new Down syndrome pathway. And Caroline and the rest of the parents were the absolute driving force behind those improvements. Next slide, please. So how the boxes fit into that then. Initially, we got a small amount of funding from the Child Health Wellbeing Network. It was a grant for £1,500 because we knew that one of the biggest gaps in our pathway was that first support for families, that information. So we built on the box. We got that commissioned as part of our pathway. So we were confident that parents were going to receive that while we were commissioning it, because obviously the charity, it's based on charitable funds and goodwill of others who were making some of the content. So we wanted to make sure that our families got that good experience. We've done a paper since then to try and sustain some of this work that we've done, which we've managed to extend that for a further 3 years. That's just an example of the box there. And we also built on that by creating a new parent carer pack. Just in case we weren't able to sustain the gift boxes, we still wanted a way to get families the information that they needed. And I'll talk about some of the contents of them in a sec. Next slide, please. So this is something else we've done in expanding on those gift boxes. We've got a new parent champion service that Down Syndrome North East are providing. So at diagnosis, whether that be antenatally or postnatally, our families are linked up with a parent champion from Down Syndrome North East. So they've got support and advice and guidance from someone who's been through the same. Next slide, please. And this is just some of the work that this has enabled us to do. So we co-produced all of these leaflets with parents, and our parents were telling us that not everybody does know what a physiotherapist does, and everybody doesn't know what a dietitian is responsible for, or an ophthalmologist. So they just wanted something in a bit more friendly format, and giving them the details of what professionals they might come across in their child's life, and if they had an issue, where they were to go if they had an inquiry as well. Next slide, please. And this, we have got a pathway that is for the trust that's been done now and is now currently being embedded. As Caroline said, we've got our first tester now. So we're going to follow Amelia and see how that goes for that family and make sure that everything's happening how it should be. But we created like a high level pathway for parents, because you can imagine how detailed the one for the trust is, all those different professionals involved. And parents helped us design this too. And it just gives them a bit of an idea of what they should expect and when they will receive it. And again, who to contact about different queries that they might have. And we can share, we've got a website address for all of our Down syndrome pathway work, so we can share that as well with everybody to have a look at. Next slide, please. Oh, that's the front cover of our new pathway that's in North Tees and Hartlepool now. A lot of it was just about articulating the offer for children with Down syndrome, but to help parents understand what their child should be receiving, and of course new staff coming into different services in the trust. Next slide, please. And again, that's just letting you know which services were involved and which ones we've covered off in the pathway, and it gives detailed age range of what can be provided when in which services. And it's actually, we found already that it's helping parents to just navigate a little bit more than what they were able to previously. Next slide, please. That's it. Done. So that was a bit of a whistle stop tour, but you can see how Caroline's Baby Box really helped us to be able to start embedding that work, and that's actually been a real key part of getting that pathway in place.
Thank you both so much. Although the clock would suggest we're 4 minutes behind, we're not really, because I'll just cut out 4 minutes of my waffle from the second half, which nobody will notice is missing. I'm going to speak on behalf of everybody on this call because I know I can. What you are doing is just fabulous. Both the charities have really impressed us all with the love that goes into those boxes, let me tell you. And I think there's a big audience out there of health visitors, midwives, neonatal nurses in the north of the patch who are desperate to go talk to their managers about how far your conversation with management is progressing, Caroline, because it's definitely wanted up north, no question about that. And I think, in line with some of my comments at the beginning, networking like this will make a difference and it will have impacts, and we will see things move further than we expected, I'm sure. My final comment is, let's get the ICB to back both these initiatives, because although there is a cost to it, the value is just immense. And what you've described in how it impacts young parents, either because they're first-time parents and they have additional support needs, or because they've had a child with Downs, they are being given really powerful messages about how they are not alone, how they are part of a community, and what these boxes do is give them so much that the cost is irrelevant, and it's the value that we should be talking about in the next half. So great. Let's have a really interesting conversation after 5 minutes break, and we'll meet back here at 11:05. Thank you. Okay, everybody. Hopefully most people are back. And if you're not quite, you'll be back in a second. So if we were meeting in person, we'd have a little stage at this point, and people would come and sit up on the stage. So we're going to have a virtual stage. We obviously have the speakers from before joining us. So we have Claire and Sean from the Children's Foundation. We have Caroline from Down Syndrome Northeast, and we have Amy from NEX Commissioning Support. And in addition, I'm so glad you put that up for me, because I was desperately looking on my notes. Claire, I know you're on the call. Do you want to say hello, Claire?
Hello. Yes, I'm here. Been listening throughout. Very interested and fascinated. Yeah, really good to be here.
You're a family nurse practitioner based in Gateshead, and you've been integral to the progress of the Children's Foundation Baby Box.
Yeah, the pilot project. Yeah, I have.
Excellent. Becky, is Becky on the call?
Morning, yeah. Nice to meet everyone. I'm Becky Humphrey, Specialist Health Visitor for Complex and Vulnerable Families, and we have just introduced the pilot for the baby boxes in Newcastle.
For the Children's Foundation one?
Yeah, that's right.
Yeah. And Thomas, we've heard lots about the fantastic support that Still a Give. Are you on the call, Thomas?
I don't think I can see him, but it'll be
No.
Thomas or Dan if they join, but they were going to be joining a little bit later. So
okay,
if there is anything, then I can help. But if not, they might be on a little bit later.
All right. So if people on the call want to stick questions into the chat, we've got a couple from earlier that have gone on, but please stick in your questions in the chat and we'll make sure that they get asked. A quick question from before about the Children Foundation boxes. Can it be used as a cot, and do you recommend it is used as a cot?
Shall I answer that one, Claire? In short, yes, they come with a mattress. The box and the mattresses carry the British safety type mark, and the first few boxes that went out in November included the mattress. However, just before Christmas, we got an email from the Deputy Chief Nurse for the Office of Product Disparities at Department of Health to say that there were concerns, not so much about babies being put in the boxes for sleeping, but more about boxes going into cold, damp homes. So she asked that the mattresses be removed temporarily while the risk assessment was reviewed by the Office of Product Safety Standard. It wasn't just for the baby box, it was for several products that have recently been awarded the British standard Quite mark. This was really disappointing. But we had no choice. These boxes are going out through local NHS providers, and we're still waiting for that updated risk assessment from Department of Health and the Office for Product Safety Standard. We'd worked with the Lullaby Trust in the lead up to this in Christmas, and they actually updated their guidance, sort of promoting the use of boxes as an emergency sleep space where a cot or a Moses basket cannot be provided. And that is what we hope will happen as we move forward, that where a cot or a Moses basket can't be provided, the boxes can be used as an emergency sleep space for babies. We're yet to be presented with any evidence from anybody to suggest that the use of a box for a baby sleeping in is unsafe. However, we've got to sort of, go through the relevant processes with Department for Health and the Office of Product Safety Standard. We have been issued with an email from the CW1 committee, which is the British Safety Standard Committee, who have concluded their own evaluation, and they inform the Office of Product Safety Standard, and they say that as far as they're concerned, that the boxes have been tested for damp conditions in cold homes, and as far as they are concerned, are safe for use. However, we've got to wait for the findings to come out of ops, which we hope to have by the end of this month. The meeting was meant to take place in August, but was cancelled because the deputy chief nurse was off on the sick. So we're just playing a waiting game.
Yeah. I think that might be quite a long wait, unfortunately. That sounds like a bit of a black hole that information may never come back out of. Carla has her hand up. Is it a question specifically about this, Carla?
It is, yeah. Is that okay to ask a question?
Sure, sure.
I know I'm a flea in Sean's ear all the time about the box and the sleep about them. And I love the baby box and I love the concept and the developmental opportunities. I do. It's just the sleep. And I know we've had these discussions before. So if the mattress is going to be included and if it's given the go ahead by the chief nurse, will there be a specific Lullaby Trust leaflet to say it's for emergency sleep only? And will that be really clearly stated? Because I know there's some research where parents have put babies in these boxes and then put the lid on. So it's just about not assuming that parents are going to use them for the correct means.
Yeah, absolutely. So if the risk assessment evaluation from ops comes back to say there is no risk, we then assume that, you know, the mattresses can go back in, but it will only be where a cot or a Moses basket cannot be provided and for emergency sleep space. The Lullaby Trust leaflet will go in. The safety instructions are also included in the box, and they are printed visually, pictorially on the inside of the lid. It's our hope that this will be the case, but we've just got to wait. I have to say, the boxes are about baby development and parent and baby bonding first and foremost. We chose the box as the delivery mechanism for that concept. The fact that they also double up as a space that the baby could sleep in is almost a bonus, but I think it kind of like it comes with the box. The mattress and the box come with that safety mark, and we hope that you know, we'll get that approval. But obviously, and rightly so, until we do, boxes are going out without the mattresses.
And I'm assuming that the other box, the Down syndrome Northeast box, isn't a alternative to cot because it looked too small apart from anything else. Am I right there, Caroline?
Yes, you're right. Our baby box is around about the size of a large shoe box. So yeah, definitely not intended for sleeping in. Just for it's a nice storage box, actually.
Maybe for a hamster.
Yeah.
Suzanne, presumably it was you that put the question in the chat, Suzanne, about sleep. Do you want to come in?
Yeah. Hello, I'm Susie William. I'm a pediatrician at the QE, and I look after lots of children with Down syndrome and other disabilities. So the baby box, I think it's a fantastic idea, but I knew about it mostly from Scandinavia, where many families use it as a cot, and I think it's quite a safe idea. And I don't know why. I have two questions about it. Is there age range for the babies to be able to sleep in the cot? Probably once they're outgrown it's not safe. And why is it only in an emergency if it's deemed to be safe? Because I think some parents might not even have a Moses basket or a cot available, and the baby box could be sort of a permanent cot for the first few weeks. I don't know if any research or work has been done on that.
Thanks, Suzanne. Who's going to answer that? Claire, do you know?
Yeah, so I can answer that one. So the being used as a sleep space, it would depend on the baby, but usually about 0 to 3 months would be that time frame which the baby could sleep in it. Yeah, in Finland, you're right, for about 70 years they've been using it as a sleep space. It's actually the same box that's used in Scotland, which is also can be used as a sleep space. And there are other schemes across the UK, down in Warwickshire, where the baby box is being used as a sleep space. So it's just been specifically in the Northeast at the moment that we're going through the ops with it. With the Lullaby Trust, we worked with them when we started when the project got underway in November. And I think, to be honest, the concept of a baby box and sleeping in it is really new in the UK. And I think anything that's new and change is like hard for people to accept as well. And so, and it's the same with the Lullaby Trust to a point. They changed we went back and forth with them over the sleeping in a box, because a lot of the kind of the information on it had been on like old reports and some of it misinformation as well. So that was go back and forth on that. I was just going to say something. I've just lost my train of thought. Yeah, I've just lost my train of thought now. But okay. Yeah, sorry. It will come back to me.
All right.
Thank you.
Can I just add in there as well? Sorry.
Yeah.
So as health visitors, if we're identifying a baby antenatally that doesn't have a cot, we wouldn't be expecting that parent to use a baby box. We would be working with that family, especially within the early help arena, to try and source somewhere safe for that baby to sleep. So I would not be expecting a baby to come home discharged from hospital and not have anywhere safe to sleep.
Yeah. I think just another issue to raise is that I know when we met with a health professional in Northumbria, they were huge concerns over a lot of co-sleeping, and they saw how the baby box for them was just going to be amazing because it would actually help with that, actually stopping a lot of co-sleeping that was going on. So I think at the moment, like Sean said, we have to wait until we get that information back from ops, and then we can go ahead. But the focus of this baby box is baby development, and that's why when we did the pilot with Newcastle, they were fully aware of this, but they could see the value of the box and everything that's in the box and what the box is, like the whole focus of it is around the books and the toys.
Great, thank you. We are going to move on from this topic because it is contentious. It's clearly very important for whatever reason. I mean, when we first thought about baby boxes within Newcastle Gateshead CCG about 8 years ago, the first reaction was they're probably not safe for babies to sleep in. And my own feeling is I'm not sure you're going to get a clear, endorsement from national bodies. I just don't think that's likely to happen. But as you point out, it probably is not the most important thing about the baby box that the Children's Foundation are promoting. It might well be, a UK or an English kind of personality thing that makes it quite so difficult. But we should move on from that. And I'd like to move on by asking both organisations and people working with it to tell us a little bit about how the box on its own, it doesn't come from Amazon. It might come from DPD, plonked on your doorstep, and then that's the end of the conversation. It is wrapped around, presumably, by health visitors, family nurse practitioners who work with and charity champions from Down Syndrome North East who work with the recipients to understand what comes with the objects in the box. Tell us a little bit about that. Let's start with Caroline down in Teesside and the wraparound that goes with the physical objects that you like to see take place, and then we'll come back to Children's Foundation box.
For ours, quite a lot of it is around making sure that professionals involved with families are actually aware of the services and support and other charitable organisations that are available to provide that support, because we know that quite a lot of people who work with our families don't have that information. And so a large part of it is us providing those links out there. But also, as Amy mentioned, we have a parent champion service that we are doing particularly for Tees Valley hospitals, but we really do it as an informal service whereby as volunteers, we make sure that families, when they've received a baby box or when they've received a diagnosis, first of all, some people are not necessarily always ready to receive the gift box. Sometimes they just want to get used to baby's diagnosis first before they receive items. And I know we have had some feedback from one of the hospitals that families did leave the hospital without the baby box because they weren't quite ready yet. so the difficulty for us there is, because we're a charity, is how we then keep those links with those families so that we can then provide that support later on. And I think around that is to make sure that as many professionals working with families as possible are aware of what we do and what we have available, to make sure that then if parents do want signposting and do then at a later date want the support services that we provide, that is there and available for them really quickly and easily.
So presumably having a volunteer deliver the box in person is the beginning of that conversation. They might well deliver the box and then engage with the family there and then in talking about the work of the charity and so on. Is that right?
It is, and a lot of it's just, asking the family, asking mum, dad, other members of the family how they are, how things are with the baby, because sometimes baby might be poorly, might have had a bit of a time in neonatal, so they might need support around that too. But yeah, it's building that relationship, and making sure that families know that we've got links to other families that they can be befriended by, to provide that peer support too.
Great, thank you. Amy.
Sorry, I just wanted to add to that what Caroline mentioned there about the signposting that was happening from the trust. It was a couple of leaflets from the Down Syndrome Association, which is like national, so there was nothing local. But we realised how busy the trust staff are, particularly as neonatal and postnatal wards, and for them to be able to go searching for the most up-to-date information and the best places to signpost families to, we feel we've taken that away from them now, so that they don't have to do that, and it would be down to Caroline and us as the ICB to make sure that that's constantly the most up-to-date information, and it's just one less job for the trust to look after, isn't it?
Yeah, I would agree with that. Yeah.
Thank you. Let's hear about the Children's Foundation box, and how is it used by the professionals? Claire, do you want to talk about the opportunity that the box gives you to engage?
Yeah, absolutely. What we know is that one of the most important protective factors in terms of children's outcomes is having this great start, this best start, having an emotionally stable and warm environment, and having an environment that's also developmentally stimulating. And this box provides a wonderful opportunity before the baby's even arrived to start having a think about those conversations. And as Sean mentioned earlier, it's in the simple everyday interactions that the bonding and the attachment develop. So this box, with its multitude of opportunities for discussion and lots of valuable toys and equipment, because it's not only in the play, but it's also in the everyday life experiences, such as nappy changing or taking temperatures, whatever. Every interaction counts. And so this box, before the baby's even here, we can start thinking about the contents and what that might look like in terms of the activities with the children, with the babies. So yeah, it's provided a great opportunity to introduce it. I mean, I've been involved since the beginning, and I suppose we're coming up to about a year since the first families received their boxes. So now we're entering this phase where the children, the older infants, if you like, are playing with some of the more advanced toys. So it's a box that can be used over and over and over again, and referred to frequently during the course of the work that I do across the first year and probably beyond as well. So it's been a great resource from my point of view. And it's been very well received. One of my families the other day said to me, Claire, we can't believe it. We thought we were getting a sort of a shoebox size box, but when it arrived, it was huge because it's about 1 meter long. So they were totally surprised and wowed. Those are the responses that I get when I go in when they've received their box. Lots of popular content from quite a few of them. Definitely the play mat. And it's great from my point of view, because we do a lot of work around play and development, is that the play mat is the focus. So we get the play mat out, and that's the focus for our interactions and our play activities. So it's a wonderful, wonderful resource from our point of view.
Great, thank you, Claire. Becky, do you want to add your thoughts?
Yeah, so just to echo what Claire said, really. However, within Newcastle, we've only just started to start the pilot of giving out the baby boxes. So we haven't actually got any parents at the moment that have delivered their babies to start and use this box. But what we are working with is the local family hubs, and they are going to develop a play session that parents can go to, and the family partners within the play sessions, they are actually going to be, they've got a box themselves, and they're going to use that box within their play sessions as well.
It seems very clear to me that the wow factor that Claire just referenced is such an opportunity, isn't it, for all the professionals to start on a positive note, building really strong relationships with families that have, in your work, Becky, vulnerabilities of one sort or another, for example, because the joy and the celebration that Caroline talked about is really important to be a nice place to start in relationship building. And I think the wow factor of both boxes comes across very strongly. Question for you all. Tell us about Dad's experiences of being recipients of the boxes. How involved and thrilled are the dads that you've come across? Who wants to go first?
I'll go first. Yeah, I think sometimes dads can be a little bit left out or forgotten in amongst all of the pregnancy and the labour, the antenatal care, etc., etc. But the box delivered to the home and having a visit incorporating both parents gives him an opportunity to think about his baby and start forming those bonds even before the baby's here. Certainly one of my dads had forgotten all of his nursery rhymes, or at least he couldn't remember ever knowing any. And he did take out the book with the rhymes, and sat with his baby on the lap as we discussed. And he was amazed at how much interest the baby took in the book. And it was really a catalyst. He probably said to me, he probably would never have done this unless the book had been in the box. But it was a catalyst for him to engage more with his baby, because he realised that he was getting some feedback from the baby, even though the baby was really quite young. So yeah, it had a real positive impact for him in terms of engaging with his baby and being involved.
Thank you. Caroline.
I think we tend to get, I think, as many dads as mums contacting us to ask for our support anyway. I don't think there's necessarily just mums that contact us, and so as far as the feedback's concerned, both parents are providing, positive feedback about the impact that it's having. And I think as well, the books that we put in are quite nice for everybody in a family to use and to look at and find out kind of quietly in a quiet moment, sit and have a look through the book. Without maybe wanting to have too much of a conversation about, because all parents think about, the future for their children. But when you have a baby who has Down syndrome, you might be thinking about the future and worrying a little bit more, but maybe are not kind of that keen to verbalize it or talk to your partner about it. And I think the books in there are a nice opportunity for dads, grandparents, siblings to find out a little bit more and be reassured, I think, and so that's some of the feedback that we've certainly had.
And your charity is parent-led, parent-run charity.
Yeah.
Do you have a good proportion of dads as the engine room of the charity?
Well, we have 12 people on the committee, and 2 of them are dads. And we have 3 or 4 dads who are volunteers, possibly more actually, because some of our older adult members, their dads are volunteers as well. So yeah, we certainly have. It's largely mums, to be fair, but we do have some dads who are volunteers and are committee members too.
Great. Claire, at the Children's Foundation, what's your experience?
Sorry, yeah. So currently the pilot at Gateshead in Newcastle is going to first-time vulnerable parents, and a lot of the questionnaires at the moment, the feedback is with the mothers. But with our additional funding that we've got at Gateshead, something that we want to discuss is like looking at additional referral routes, and that could be working directly with dads, because a lot of the time, like you said, it's mothers that the baby box goes to, but actually there's no reason why we couldn't be working more with dads, and that might be something that we look at as we extend the project. There's also a lovely project called the Dads and Lads Project that many people will be aware of in Gateshead, and they are also putting their card in so that dads can refer in, so they could get a bit more support as well. But I think going forward it will be looking at other referral routes, not just necessarily first-time mothers, but it might be care leavers, it might be dads. But right now it's more focused on the mothers.
Great, okay, thank you. We've still got a good few minutes, and I'm not sure I've seen, lots of people are asking about social media for you, Caroline, and you've been answering them in the chat. I'm not sure I've missed a lot of questions in the chat, so let's invite the audience to put a hand up if you've got a question you'd like to ask. That's killed it, hasn't it? Okay, well, from now on, anybody you want to ask something, stick up your hand, because I'll find it easier to know that you want to ask. One of the things that I thought the slide you put up, Claire, at the start, talked about some of the feedback you'd had, and I wrote down the words that you'd highlighted: prepared, feeling more prepared, more confident, more supported and happier. And I wondered how that links in to the reasons why people refer. We know it's for first-time mums specifically, but presumably, and maybe Becky, you might comment on this, is it when you get a sense that the first-time mum needs support with preparation, needs support, maybe lacks confidence, or maybe is unhappy, that you think this person could really, this family could really benefit from this baby box? Becky, what are your thoughts on that?
So we offer the baby box to all parents identified as part of our Healthy Child Plus offer, which is a vulnerable parent pathway that we are commissioned to deliver. So we would only give out the baby box to first-time parents that had identified vulnerabilities, and we had offered the Healthy Child Plus too. So it runs alongside having a named health visitor, having extra support visits throughout pregnancy and post-delivery, so that we are able to offer the baby box alongside an enhanced service from health visiting. We've only had one person that has declined the box. Other feedback is that it's really reciprocated really well, it's positive, and I've only ever known one person decline Healthy Child Plus throughout the 3 years that I've been in post, and we've had the vulnerable parent pathway. Most parents want a named health visitor. They want to have a health visitor for the first, certainly within the first 1001 critical days, and building that relationship has been key in that.
Great, thank you. Claire, any additional comments from the charity's point of view? Are you very much led by the professionals on the offer of the box?
Yeah, we leave it to the professionals to, they know the parents they're working with, they have those relationships, they're the experts. So it's working with them, but ultimately, yeah, they'll be putting the referrals in for those parents, and then what happens is obviously we get the referral, then we let Stilla know so that they can deliver the box to the family. And then once that's been delivered, we would check in with the family basically to make sure they've had the box, and that we would then do the evaluation with that parent as well.
And there was very early on, there was a question from a neonatal nurse, I think, who was saying, can we have these up in Northumberland? And the answer to any of those questions is, if we can find the funding for it, you're happy to provide it anywhere.
Of course, yeah. So yes, the answer is definitely yes. Like, get in contact, because it's about trying to find that funding, and that's come, like I said, from different pots. So it's talking to kind of the commissioners there. It's like I said, for Gateshead, it's the Family Hub funding. So get in touch, and then we can go from there. And we could even meet your team with the baby box just to initially see how it goes down, because actually seeing the box in practice is a completely different thing. I know I've shown you the lovely video, but it's amazing, and it really, like, the parents are just overwhelmed, and it really does feel like a hug in a box, and it's got everything that the parent needs to interact with their little one, and it's that part of that whole framework with the health visitors and midwives that makes it so special.
Absolutely. And I think both boxes, you know, whatever it costs, what you are able to achieve at the very start with those boxes, those gifts, as you say, a hug in a box, a gift of that really connects people at a time of change and perhaps, you know, anxiety, is just priceless, I think. This is totally unfair, Amy. Do you have a sense of where this might land with commissioners within the ICB in a positive way?
I think so, but I think it's always focused on outcomes, isn't it? If we can identify a gap and then something that we can see there's working, and we've got evidence of those outcomes and how it's improving things for families, and it's improving that connection with your baby, because there's a lot of work going on around Northeast North Cumbria around speech and language pathways, which we've in the Tees Valley. That connection starts that early from what you're trying to do with that box, and we're trying to encourage families to have that connection and bond with the baby. So it links into a lot of different pathways that potentially some people wouldn't see. So I think it's about thinking outside the box, should we say?
Yeah. But you think that there's a productive conversation to be had with the commissioners around the positive outcomes. But my challenge back to them would be, this is not going to be KPI'd. We're not gonna change the world one child at a time, as the people described, by, you know, measuring how tall the kids end up being, or something, you know, very hard and tangible like that. It's the story that we heard from Claire about the dad who said, I'd forgotten all these nursery rhymes, or I never knew them, and I did not realize that reading to my kid could be such a positive experience. That is absolutely priceless, and that qualitative evidence, I think, should clearly be enough for us as people in the statutory system to take and run with. Sean.
Just to add to what Amy said, as part of the Gateshead, oh, there's my phone, go and look at the same time, hang on. Sorry about that. Sorry if anyone was just trying to ring us there. As part of the pilot at Gateshead, the local clinical research network are providing an evaluation report, which is due out early next year, which of course we'll share with the network and anybody who's interested to try and demonstrate that impact in the outcomes on families, those 50 families who received the box. But the Children's Foundation are continuing to carry out the same evaluation questionnaire with the additional 400 families in Gateshead over the next 2 years, and the 150 families in Newcastle that we currently have the funding for. So we should have a huge amount of evidence and the voice of the parents to share, to help you know, those in commissioning with decision-making powers to do that. I've just written down one thing from today, and that's about compassion. And so Al talked about that when he opened our launch event in March. for me, what I like about this is it shows compassion. It shows that we place a value not only on that new parent or caregiver, whoever that might be, but also the baby that's yet to be born even. And I think, you know, that is in itself is one of the key motivators here. This is about compassion. It's something for them. It makes them feel valued. It's physical. It's there in their hands, in the homes. And likewise for dads, I think because the boxes from the Children's Foundation's point of view are not about, you know, feeding and sort of like, you know, grows and cloths and nappies and things, the toys and the games and the resources enable that interaction, that tools for kind of all to be involved and have a role in that baby's care.
Great, couldn't agree more. Becky?
Yeah, thank you. I just wanted to add that I do actually report, do a KPI report each quarter on the Healthy Child Plus, and this quarter, by the end of September, will be the first one that includes data on the baby boxes. And what the data that I have had, for particularly within the last 18 months, is that the Healthy Child Plus has really good outcomes. So 50% of the families that have been identified as being vulnerable, they return to universal services at the end of the Healthy Child, at the end of after a 2-year assessment process. And the remaining children that are have an enhanced service from health visiting, they have either been identified really early to have children's social care needs, or they've been early identification of children with additional needs. So it's proven that we are identifying need at a much earlier stage and being able to work with parents and build that relationship. So in terms of reporting, I'm hoping that this baby box is only going to enhance the data performance that we are showing at the moment.
Great, thank you. Caroline, what kind of evaluation is going on with your project?
Well, because obviously we're quite a small organisation, and we're, you know, parents ourselves to children who have additional needs. We're somewhat limited in the capacity that we've got to do that. However, what we do is collect feedback from parents, as you saw on the slides. Whenever parents receive a box, myself or one of the other volunteers is in contact with them, and we get feedback from them to make sure that you know, they tell us whether they like the contents of the box. We ask whether there's anything that parents would like, you know, change, whether there's something additional, different that they would have liked in the box, so that we can think about how to develop it going forward. As part of our work with the ICB as well, in terms of the funding that we've received, you know, that's reviewed on a very regular basis, and that the outcomes for parents to feedback how they have felt about things like how it's impacted on supporting their mental health, their well-being, and their capacity to access services for their baby. That's an ongoing process, obviously, and that's something that we're keeping working on, and we'll be gathering that data on, hopefully to look for more funding in the future to keep this an ongoing project.
Great, thank you. Final comment. Amy, have you got any final comment for us?
Just to say what good projects they both are, and I could see longevity in both of them, and what it could bring. I think there's opportunities across the ICB for us to look at how these can be embedded into pathways and become more of an everyday occurrence, rather than it just being on, we have these pots of funding that come, don't there, and things come and go, and it would be nice to be able to sustain some of this work, I think. But yeah, them outcomes are key, even qualitative outcomes that will help with any conversations, won't they, about carrying this forward.
I agree with that, Amy. I mean, if we, as a system, if we can't sustain the fantastic stuff these projects are demonstrating, then we might as well all go home, is my view, frankly. Claire, final comment from you?
I think honestly, it's just, let's invest in early years. Like, this is making everything that we do in early years has a phenomenal impact on everything else the rest of our lives. So let's yeah, please just get in contact. There's such lovely projects, and yeah, I think that's my summary.
Great, thank you. And Caroline, anything you particularly want to add?
I just want to add that, you know, a big part of our work is about celebrating the lives of babies who are born with Down syndrome and people with Down syndrome generally in society. And it starts with these boxes, and that's a big part of our work. So yes, please do get in touch. My email's in the chat, and I would love to be shipping more of these out to those of you who don't have them in your hospitals yet.
Great. Apologies to Sean, Becky and Claire, but I'm going to move us on now. And I get 5 minutes. I won't take 5 minutes. I get a moment to do some reflection of my own. And my reflection is the celebration, as you put it, the hug, as you put it, Claire, the positivity of these two approaches is just so evident that I think all of us on this call can see that this is so important in beginning to build relationships between professionals, between parents, between families, between support networks, on the right note, rather than us continually talking about the challenges and the hardship that people might face. So we know that there is a worsening rate of child poverty in the Northeast. We know that we're on the brunt of all the societal ills that are making life tougher for people at the moment here in the Northeast. But we have a bunch of people out there doing fantastic things, using cardboard boxes to be the place to start the conversation. The issue around baby safety for sleep, I'm not sure that that's ever going to be resolved easily or quickly, but that doesn't matter. The positivity between these projects that can go on fruitfully regardless of whether the mattresses are ever used or not, I think stands out a mile. I think, I've been a commissioner in my time, and one of the things that I found always a bit frustrating is when you could see something really valuable, you spent a lot of time trying to work out how to sustain it. Well, we have to get better at understanding the value and committing to collectively making sure that we sustain projects like this. And I, for one, have thought this couple of hours spent has been absolutely fantastic. Thank you for the work that you're doing. Thank you for coming and sharing it. And all power to your elbow. There we go. That was only 2 minutes, Jen. So you've got a couple of minutes spare to tell us a bit about what's on the horizon.
Amazing. Thanks, Guy. Yeah, just with our last few minutes, I just wanted to highlight a couple of pieces of work from within the network that may be of interest and or use to you in the coming months in your roles. So we've talked quite a bit today about inequalities and the effect of child poverty in our region, but where that sits within the work that's going on is around this core 20+5 model that you may or may not have heard of. It's an NHS England created model, and we've done quite a bit of development work on it in the region and within the network with our health inequalities advisors. And in essence, it's supposed to be a means of addressing health inequalities in healthcare settings, and those 5 clinical priority areas that you can see there: asthma, diabetes, epilepsy, oral health and mental health, are the national focus for this inequalities work. The development work that we've done in the network is to look from a broader determinants perspective at the model, and that's those 5 priorities across the bottom there. And the aim that we've tried to reach for with this is to make it a workable model for people in any sort of setting. So a lot of you do come from healthcare, But this model is designed for use in education, in VCSE, in local authority settings, anywhere where you want to address a health inequalities problem. It gives you a sort of process to follow, if you like, to address what your issue is. You could have a whole huddle on this. In fact, we did in July when we launched the model. So there is a toolkit available at that link there, which we'll share the link with you if you want to read a bit more about it. But essentially, it will guide you through the process of using the model to address any sort of health inequalities improvement project you might be thinking about within your role, which population group you want to target, what sort of clinical priority area you want to look at, and it gives you a process to work through to create a piece of project work around it. And having just created and launched the model just before the summer, we're now in the process of, and then what? So what are people going to do with this now that we've got the toolkit available for people to use? So if anyone's interested in potentially having a conversation about using the Core 20 model for a health inequality project in your area of work, do get in touch with us at the network, because we're keen to sort of think about some next steps, maybe run some additional pilot projects using the model. So do get in touch if you're interested in that. And then as winter is barreling down on us, our focus very much turns to sort of winter pressures on the NHS, on health services in general. So our sort of main tool for that from the network is our Healthier Together website and app, which hopefully a lot of you will already have heard of, but it's essentially a means for signposting parents and carers to the appropriate course of action when their baby or child is poorly. So there's an app you can download, and there's a website that's got lots of additional information on for professionals as well in terms of clinical pathways and that sort of thing. Loads of resources on there. All the Core 20 resources are on there as well as some other training stuff. So the audience is parents and carers primarily, but like I say, with those professional resources on there. And it works similarly to the Little Orange Book format, which we've already talked about. That's hosted on the Healthier Together website as well. And it will basically reassure the parent if they can self-care at home or if they need to take some course of action. It will direct them to the appropriate service to access all the way up to emergency department if necessary. And the way that we're trying to push it out to health professionals is that this can be a tool for you to use when you're seeing families in your clinics and in your services, and when you're seeing them in their homes if you're out in the community, is to make them aware that they can download the app, that they can access this information for themselves. And it's that sort of safety netting that we always talk about, whereby you've got that reliable source of information. It's been locally clinically approved in terms of the advice that it gives. And it's got this clever little function as well by where you can share the link to the person's phone. So if you're talking to a parent and they've got a particular concern about rashes or, you know, a fever or anything that they're not sure about, you can send them the link to that direct page to their phone, and then they can access it really easily. So it's just got some clever little tools like that that might be useful to you. These are the apps that you can download through Google Play or the App Store. We're having a really big push on it in the next few weeks so that we can get people using it ahead of the winter pressures season. So please do have a look at it yourself, encourage your colleagues to have a look at it. And again, get in touch with us. My colleague Laura leads on this work. There's lots of promotional materials that you can use, posters and little business cards and things like that, which are already out and about in a lot of settings like pharmacies, and some hospitals already have them up in their waiting areas and that sort of thing. So do get in touch if you would like to ask about any of those. And then in addition to the physical materials, we're doing quite a lot of online comms around it in the coming weeks as well. Laura's planning a programme of lunch and learn type webinars on particular winter pressures topics, and how Healthier Together can be used as a tool to support management of those in services. And then we've got campaign toolkits going out through your organisational comms as well. So you might find them filtering through into your staff newsletters and that sort of thing as well, all being well, if it works. And lots of activity on social media as well, directed directly at parents. And then just another plea really, that again, if you're not already a network member, do get in touch with us through the link in the chat that my colleague Amelia has put in to join. And then you'll have access to all our comms going forward. We send out a weekly email bulletin on a Tuesday, a full newsletter once a quarter, and then there's various other pieces of work that you can have the opportunity to get involved in if you so wish. When you get these slides, you can use all these QR codes and the links to access things. This is our last newsletter if you want to have a read. And then there's various links and different ways that you can engage with us if you're keen to. Please do. Like I said at the very start, the network is its members. So the more engagement we have from you, the better we will be. And that's just for me to sign off from my end. And if there's anything else you want to say, Guy, and then we can all go on with our day. Thank you so much.
Thank you. Enormous thanks to Jen and the whole team at the Child Health and Wellbeing Network. They do enormous amounts of work with very limited resources. We as a network are not the commissioners of all things to do with children, but we absolutely make a difference, and you can help us make a difference by getting on board with the network. I think this is a great example. I think, you know, there's going to be a lot of new supporters of projects around these initiatives and these approaches, whether it's the baby box from Down Syndrome Northeast or the one from the Children's Foundation. And I know, like me, you will have found today absolutely inspiring hearing from everybody. So my final thanks are to the presenters and to other members of the panel. We will do all in our power to be silent and not silent supporters of progressing this work, and I think the network is the ideal place for us to make sure that that happens. So thank you very much for your time, everybody, and I hope you enjoy the rest of the day, and please come and join us at the next huddle that Jen was talking about. So that's it, I think. 4 minutes early. Thanks, everybody.